This program is proudly brought to you by Appiah's Trendy Wardrobe and Kitchen, Kokado's Healthy Cuisine, and Vista Pediatrics.
Welcome to the Two Words Mom Show, the parenting show that explores the ups and downs of parenting and raising happy and healthy kids. My name is Efuwa. Today we tackle the topic of G6Pd in kids. If you have ever wondered what G6Pd is and how it affects people and how it can be managed, this is the right show for you. Now this show is proudly brought to you by Kokado's Healthy Cuisine. Kokado's has salads, detox packages, smoothies, Greek yogurt, parfait, granola, wraps, sandwiches, juices, and the famous bougie Burkina. You can call or text them on 0541 022 896. We are also sponsored by Appiah's Trendy Wardrobe and Kitchenware. They have all kitchen appliances, including microwaves, kitchen stands, non-stick saucepans, rice cookers, air fryers, blenders, kettles, and so many more. They also have kids' dresses, corporate dresses, casual dresses, outing dresses, and church dresses. They have men's clothing like shirts, khakis, jeans, trousers, shorts, and many more. You can call or WhatsApp them on 0208 759 436. Also text them on the same number. We will be back after a short break.
This program is proudly brought to you by Appiah's Trendy Wardrobe and Kitchen, Kokado's Healthy Cuisine, and Vista Pediatrics.
Welcome back from the break. Today with me in the studios, everyone's favorite pediatrician. I don't know. I say pediatrician or pediatrician. I don't know. She'll correct me again. Whether it's pediatrician or pediatrician or whatever. Everybody's favorite pediatrician is in the studios with us. Dr. Appia Nkansah. She is the pediatrician specialist at Effia Nkwanta Regional Hospital. And once she is here, everybody will be appeased on this topic. Doc, Akwaba. Yeah. Are you sure I'm not too small to be your daughter? Am I Onia? No, thank you for coming. How have you been?
Oh, I'm doing well. Thank you so much.
You look radiant.
Oh, thank you.
So, G6Pd, this is a personal story I wrote on my blog. When I had Chadwick, my second boy, they told me he was G6Pd. We were like, what is G6Pd? And the doctor said, she said a lot of things. The only thing I heard was, they get it from the mom. And I won't lie to you. I broke down. We were in the hospital. I rushed to the washroom. It was like a private ward. I went to the washroom, locked myself. I started crying. My husband came and said, "But honey, why are you crying? Don't you trust God?" I said, no, this is about God. Because I was so scared. The name alone, and I had blood cells and I had deficiency, it scared me so much. I'm very happy you are here. I mean, now I know better, and I want all parents to also, know what it is about. So now that you are here, from your perspective as an expert, what is G6Pd? how does it affect kids?
Okay. So G6PD, so the condition is G6PD deficiency.
Deficiency.
Because the G6PD is actually an enzyme that is in the red blood cell. So it's a long name, glucose 6-phosphate dehydrogenase. So that's the name of the enzyme.
Okay.
So it is a very important enzyme in the red blood cell, and it keeps it in shape, it keeps it alive. So if a child is deficient in the G6PD enzyme, the lifespan of the red blood cell is compromised. So the least stress, the red blood cell can now break apart. Did you understand?
Yes.
So G6PD deficiency. And G6PD enzyme is very important in the human body because it keeps this, there is this antioxidant, if you've ever heard of glutathione. Glutathione, some years ago, I think it became very popular. There were even supplements that people were buying, quite expensive, in order to get more glutathione in their system. So glutathione is an antioxidant. And if we say an antioxidant, it's a substance that keeps free radicals in check. So you have to understand antioxidants, you have to understand free radicals. So free radicals are, let's say, substances that are produced from normal processes in the body, but they are damaging. So normal reactions in the body, normal everyday body mechanisms produce free radicals. And these free radicals too, they are produced in excess in times of stress, whether the stress is physical, chemical, or emotional. So if it's a disease, an illness can give you free radical damage, right? Stress, broken hearts, relationship issues, change in weather, leaving Ghana to go to maybe another country and you're not comfortable, you're settling, all of that can stress you and increase your free radical damage. Poor diet, lack of sleep, stressful jobs. And the free radicals are always looking for antioxidants, right? So the antioxidants will scavenge and mop up the free radicals so that the free radicals will not be available to damage the cells in the body. So the G6PD enzyme helps keep the antioxidants called glutathione in good quantity. It is believed that glutathione is the most powerful antioxidant in the body. Yes. So if you do not have enough G6PD enzyme, that means that you will not have enough glutathione. And your red blood cells under least stress can break up. You understand? So it can manifest in children from babies to older children. It's unfortunate that you have that experience because you should have been educated about G6PD deficiency in your antenatal.
During pregnancy.
Yes, because usually in the antenatal book, there is a portion for G6PD test. So the pregnant woman does this test. So if the pregnant woman is deficient, then the mother has to be counseled. In fact, whether deficient or not, you have to be counseled about all your tests so you understand the issue. Okay, so assuming they had found it that you were G6PD deficient in pregnancy, then they would have advised you that, oh, you can have a G6PD deficient son, precautions to take. Those babies are particularly sensitive to camphor. So, and a lot of pregnant women put camphor balls in their baby's clothing, cut sheets, so that you wouldn't do that. Because such a fresh baby can now inhale the camphor, and then it will go stress the red blood cells and it will break apart. Then the baby will become very jaundiced because the pigment that causes the yellow color is in the red blood cell.
I was actually supposed to come to, I was going to ask you that. What's the connection between G6PD and jaundice? Because it seems most kids who are diagnosed with G6PD, they think they have jaundice. Well, they do have jaundice. They go in for the test, and then it's found out that they have G6PD. Is there a connection? Okay,
so jaundice is just the yellow discoloration of the skin, sclera, mucous membranes. Jaundice is just the color.
Okay.
Yes. And there are so many causes. So how does somebody become jaundice? The yellow color is in the red blood cell. So when the red blood cell breaks apart, that is when the yellow or the bilirubin that causes the yellow color is released. So if you are G6PD deficient, that means that your red blood cell can break apart under very little stress. Do you understand? Are you getting it?
I am. So does that mean that any child who ever had jaundice is at high risk for G6PD?
Any child who is G6Pd
PD is
deficient
rather at high
is at
risk
high
for
risk for getting jaundice. There are so many other jaundice. Once your red blood cell breaks apart, it's going to release the bilirubin, that is the yellow pigment inside the red blood cell, and it will color you. So that's the jaundice. So G6Pd deficiency is one risk factor. There are other risk factors for jaundice. Other risk factors is a big topic.
So that one, I have to bring you back later.
There are other risk factors for jaundice. But because babies who are G6Pd deficient, they have a high risk. In fact, babies actually have a high risk of getting jaundice in the first 7 days of life. First 7 days of life. Okay. And if that baby is G6Pd deficient, the baby has a higher risk of getting worse jaundice. So any stressor that can cause the red blood cells of that baby to break down and make the jaundice worse should be reduced.
Can it be fatal?
Yes, it can. We receive them, especially the newborns in the first 7 days of life. Especially those G6Pd deficient babies, especially if the mother had put camphor balls in their baby's clothing. Because the naphthalene or the camphor balls is so toxic because it stresses the red blood cells. So if you don't have the G6Pd enzyme that is protective, then the red blood cells can break down. So the baby will become anemic because that's blood going. The baby will now be urinating and it's dark. Can be like coke, it can be like blood, red. And that can even damage the kidney. So the baby can even die from kidney damage. Then the bilirubin, the yellow pigment, can stain the baby's brain and cause brain damage. So it can lead to death or permanent brain injury. So G6Pd deficiency can be quite fatal. But there are various grades. So some have mild deficiency of the enzyme, some have severe deficiency. So it depends on the clinical picture.
Yeah. So when maybe I suspect, or the child has jaundice, and we come, what's the process? How is it diagnosed?
Okay. So usually in the newborn period, we test the babies. So we take a blood sample and send it to the lab and check for G6Pd enzyme activity.
What makes you do that? What are the symptoms?
Once the baby has jaundice, so the baby comes and the baby is yellow.
Yeah.
So examine that, especially if the baby is within the first 7 days of life. Usually a neonate, a newborn, that's a baby in the first month. But usually in the first 7 days of life, if there is jaundice, we definitely test for G6Pd. Yes. So we will examine the baby and then now take blood sample, send it to the lab. So the lab is able to tell us the G6Pd enzyme activity. So it can actually tell you the amount of G6Pd enzyme. So there are different kinds of lab. We have one that can actually measure the amount so that you know that, oh, that you have 300 and it's fine. Okay. Or the baby had maybe 60 and it's too low. Okay. And then there are some labs too that would just tell you that, oh, this baby has G6Pd deficiency. It is a full deficiency, or it is a partial deficiency, or the baby,
I think that was
no
what they told
defects.
us. Yeah.
Yes. So no defect means that's fine. The baby has good enzyme activity. Right.
Doc, this is a bit confusing for me. If the mom, why is that the mom, most moms, since the women are the carriers, have had probably all their lives and nothing happened, and somehow the kids, the babies, are having effects?
Okay, so the woman is X, the chromosome of the female is XX, and the males are XY. Yeah. Now, G6Pd deficiency is a hereditary condition. It's a genetic condition. And the defect, the faulty gene, is on the X chromosome. Okay. Now, most of the mothers are carriers. If it's just one X, so let's say you, the mother, right? You are XX. Okay. So one of your X has the faulty G6Pd gene. The other X is fine. Doesn't have it has a normal G6Pd gene. If that's normal X will balance out the one. So you will just be a carrier. Okay. But for the male, they are XY. Okay, and the male will get the X from the mother, Y from the father. So if the male baby inherits the X from the mother and has the faulty gene, there is no other X to balance it out. It's only Y. The Y cannot balance it. So the male will express it and have the symptoms. Rarely, sometimes the women too can have G6Pd full defect if they inherit two faulty genes. So the mother has an X that has G6Pd deficiency, mutated gene, and the father too donated one. Then the woman will express it. But otherwise, most of the women are just carriers. So they pass it on to their sons.
So I remember when we were leaving the hospital, because this long list of do's and don'ts. Can you run us through some of those things?
Yes, it's important that the parents understand what can trigger hemolysis or breakdown of the red blood cell. So there's medications, infections, and food.
Okay. Should we start from food?
So the food, the commonest food is called fava bean. So it's a type of broad bean. So to be on the safer side, you can avoid all the broad beans available. So those flat broad beans.
Like is it bambara or something? The one we call aboboy.
The one that is flat that we use to prepare soup, light soup.
Yeah.
That one is a broad bean. It is not fava bean, but fava bean is like that.
Okay.
Okay, so maybe you want to err on the side of caution, you can avoid all broad beans.
Okay.
But there are some of the children who cannot tolerate any bean at all. So some of the mothers do now not even give the child bean at all, including soybean, any bean, as long as it's bean. But as I said, G6Pd, there are severities. So some have mild G6Pd deficiency, and those children can tolerate beans. But if you're a mother and you are scared, you can decide that, oh, let me avoid all beans so that I don't go and trigger.
That was what happened to me.
But they don't need to necessarily avoid all the beans.
Yeah.
I actually have a G6Pd deficient son as well. He eats everything.
Now, I think you're the one who told me that I should let him eat. And
he
he really
everything.
loves the beans.
Yes.
So.
Is he hemolyzing? He's fine.
No, he's fine.
Yes.
He's fine.
So it depends. I mean, there are so many ways you can protect your child if your child has G6Pd deficiency. It's not such a big deal. Okay. And then there are some infections as well. Okay. Remember, I mentioned that any stress will increase free radicals. Free radicals will be looking for antioxidants to mop up, or antioxidants will be looking for the free radicals to mop up. So it's like a fire and water to douse the fire. So the free radicals is the fire, and the antioxidants is the water that you're going to use. Right? So if you have any infection, it can increase your free radical damage. So infections like malaria, viral infections, fungal infections, pneumonia, any infection at all, it can increase free radical damage. So you need more of your glutathione. And meanwhile, you are G6Pd deficient, so you'll be lacking the glutathione. So your red blood cells can outbreak. So infections, malaria, viral infections, bacterial infections, UTIs, they can all lead to the breakdown of the red blood cell. Right. Then medications. Medications, though they are beneficial, they also exert a lot of stress on the system, and they produce free radical damage as well. So some medications are more severe. Are more dangerous to the G6Pd deficient child. So you have antibiotics like ciprofloxacin. You have sulfur-containing antibiotics, Septrin, SP. So there is this anti-malarial that pregnant women are given when they are go for their antenatal. Yeah. So if the woman is G6Pd deficient, she will not be given that medication, that anti-malaria, because it can lead her to hemolyze. Her red blood cells will break down, and then she will bleed.
And will that affect the baby?
The baby is already in the womb. It will affect the mother. At that time, the baby is in the womb. Yeah. So the mother herself will become yellow, jaundice, pale, urinating blood, because we don't want to elicit such a reaction in the mother. So if you, the mother, you are G6Pd deficient, you are not to take that anti-malarial, the SP. So usually that's what they will tell the women, and that's the point where a lot of the women learn about their G6Pd deficiency. Yeah, so mostly the fava beans and other beans, red wine as well, some blueberries. Ghana blueberries are already expensive.
But we have people buying.
So G6Pd, blueberries can cause a G6Pd deficient child to hemolyze. Okay, so the fava beans, other beans, red wine, blueberries. Any food at all that your child eats and urinates like Coca-Cola, your child is, let's say, G6Pd deficient. That is a trigger for the child. So you, the mother, note it down, even if it's not in the books. Just note it down, because it may be stressing the child, because everybody is different. All the children are unique, right?
So let's say a child has been diagnosed. What will happen if the family doesn't manage the situation properly? If they poorly manage it, leave the child to be, and say, I know some people will be like, "Yeah, Bompay, obey, let's leave it to God and give him everything." What will happen? What will be the outcome of poor management of G6PD deficiency?
That would be that the child can easily, you see, if the child doesn't have any stressor,
Yeah.
the child can, there's no symptom at all.
Okay.
So they will be walking about, playing, growing like any other normal child. But the moment the child has a stressor, so you, the parent, you have to educate your child, if the child is a bit older, that you cannot go close to camphor. So maybe your best friend is wearing a shirt and the shirt is drenched in camphor, you can smell the camphor. Your child can hemolyze.
Okay.
You, the parents, you shouldn't put camphor balls in your sink, your drinking water, in your bedrooms to drive away ants and insects because it can make your child hemolyze. You want to reduce the chemical exposure in your house because it can make your child hemolyze. You don't just go about buying any drugs at all for your child. You have to seek proper medical attention because over-the-counter drugs, some of them can make your child hemolyze. So you have to arm yourself as a parent. And when you know that your child is G6PD deficient and you go to any health facility, let the doctors know. So that when they are choosing antibiotics, they'll be careful. Or when they're choosing certain medications, because some antimalarials as well, they'll be careful. So usually there's a sheet of paper that they will give you in the hospitals if your child is G6PD deficient. That lists the types of drugs that the child is supposed to avoid. Okay. And then, of course, with your diet as well, you want to avoid, if you are, maybe you want to be extra cautious, then you want to avoid the beans or the broad beans from the child's diet.
You are still watching the Two Words Moms show. When we are back, we'll delve more into the topic of G6PD deficiency in kids. We will be right back.
This program is proudly brought to you by Appiah's Trendy Wardrobe and Kitchen, Kokado's Healthy Cuisine, and Vista Pediatrics.
Welcome back from that short break. You are still watching the Two Words Moms show, your favorite parenting show. And this is where we answer all your parenting questions. We are still here with Dr. Appiah Nkansah, the pediatrician specialist at Effia Nkwanta Regional Hospital. And we are talking about G6Pd deficiency in kids. Stay tuned. Doc, we've been talking a lot, but I just want to know, what will a parent see in their kids and now be conscious, okay, be a bit scared that, do my kids or does my child have G6PD? And if they indeed find out that their child is G6PD deficient, what are some lifestyle changes that they can make?
So without any trigger at all, the child with G6PD deficiency is fine, no symptoms.
Okay.
But if there is a trigger, that could be food, medicine or infection or other stressor, the child will now start to hemolyze. Hemolysis means that red blood cells are breaking down, because G6PD enzyme help protect the red blood cells. So the child will now become anemic, pale. So you look at your child's palm, the child looks like the palm looks maybe whitish or less pink. If you're somebody who usually checks your child for anemia, you would know that, oh, my child looks a bit pale. But you can look in the eyes, pry the lower lid and just look. So the child is looking pale. The child will become jaundiced. So the white parts of the eye will now turn yellowish. The child will start urinating like Coca-Cola. So you know that all this is parts of the blood that the child is urinating. So the child becomes anemic and jaundiced, right? And because of the anemia, we need the red blood cells to carry oxygen. So the child, because he's losing red blood cells in the urine, or he's losing the red blood cells in the urine, will now become tired easily, heart beating very fast. More work, the child is tired, So these are some of the symptoms. But the moment you see that your child is jaundiced and urinating dark, that is blood that is coming. Wow. So you have to send the child to the hospital as soon as possible. If maybe you do not know that your child is already G6Pd deficient, then the doctors will now take blood samples and check whether the child is G6Pd deficient. Because other reasons or other conditions can also lead to the child having these symptoms, like sickle cell or malaria in a child who doesn't even have sickle cell or G6Pd deficiency. Okay. But it is worth noting that when there is acute hemolysis, that is, if the child is jaundiced, pale, urinating dark, and is G6Pd deficient, sometimes when you check the enzyme levels, it will appear normal. Okay. So we have to now wait for about 3 months when there are new red blood cells, and then we repeat the G6Pd test again, so that if the child is truly deficient, at that time it will show. Okay. This is because, yes, this is because, you see, red blood cells, we have young red blood cells, we call them reticulocytes or retics. So those are the baby red blood cells. Then they will become teenagers and then adult red blood cells. They have a lifespan of about 90 to 120 days. So as the red blood cells age, they lose their G6Pd activity. So even those who are G6Pd deficient, they have some G6Pd activity because of the young red blood cells that are in the circulation. In the event where the child is hemolyzing and losing the red blood cells through the urine, the bone marrow will quickly respond to the anemia. The bone marrow is the factory for new red blood cell production. Okay. So it will quickly start producing new red blood cells. So the baby red blood cells, that is the reticulocytes, they have G6Pd activity. So when you measure for the G6Pd enzyme at the time when the child is actively hemolyzing, it may be a false node effect because of the activity of the G6Pd enzyme in the young red blood cells. So you have to confirm with a repeat when the child is maybe in about 3 months' time when the child is not actively hemolyzing. Or sometimes if the child came in very pale and had to be transfused, the donor blood will have G6Pd activity, so it can mask the picture. So the time to actually check for your G6Pd is when your child is stable, is not jaundiced, is not hemolyzing. That would give a true reflection of the G6Pd activity of the child.
You're still watching the Two Words Moms show, and Doc, you're still going to talk about the lifestyle changes, but I wanted to come in with this. Can there be a false positive?
If it's a G6Pd no
full defect when in fact the child is not deficient.
That one is measuring enzyme. So you can have a false negative,
but not a false positive.
Because if the enzyme is there, it will pick it up.
Okay.
So if do you get it?
Yes, I do. Please take us through the lifestyle changes the parents should make once they find out that their kids are
So deficient. It's important that the chemicals that we bring into our homes, we are careful about them. Because naphthalene balls, for example, camphor balls or naphthalene balls, they are very, very toxic.
Really? Why do we use it all the time?
The naphthalene.
Yeah, since our childhood.
Naphthalene is toxic. It's even carcinogenic.
What's that?
That means that it can even cause cancer. So please don't put naphthalene in your water to drink. Naphthalene. Naphthalene. You see, here in Ghana, we call it camphor. I don't want to go there, but real camphor is actually different from naphthalene. They have different chemical structures. So what I'm calling camphor is what we all in Ghana we call camphor. That is the naphthalene balls.
Yeah.
They are very toxic. So don't use it. Don't bring it into your home. It's a chemical. It's not a nutrient. Even if you breathe it in, it will go straight into the bloodstream. You didn't eat the camphor. You breathed it in. The way we breathe in oxygen, and the oxygen dissolves into the blood in that same way you breathe in naphthalene, or you are going to get it into your bloodstream. So your G6Pd deficient son is going to react to that naphthalene, especially if he's full defect, those who have very little enzyme activity. So don't bring in camphor into your home. And I would add that even the chemicals you bring in, be careful, because you never know when your child will react to your mosquito spray. So if you have to spray your room, give the room some time. Maybe when the children go to school, then you spray, and so by the time they come back, the whole place is aerated, and the risk of that chemical going to stress the red blood cell for it to break down goes down.
Can they sleep in mosquito nets though?
They can sleep in the mosquito net. Remember that the mosquito nets too, they are insecticide treated. So you also have to observe your child. Okay, so if maybe your child sleeps in the mosquito net and the insecticide treated mosquito net and the child hemolyzes, then you know that the child is also reacting to that chemical, because there are different severities. So some of them, they will hemolyze at the least provocation, others too are more stable. So you want to be very careful about chemicals in your home. And then infection control, malaria. So you try and clothe them well, so that maybe in the evenings, don't even let them stay out too late. Maybe after 4 o'clock they have to come in. Make sure that you've weeded around, you've covered your water containers outside so that the mosquito will not go and breed. Try and prevent mosquito bites. If you can also get some safe mosquito repellents to use for your children to help them. Other infections. It's not everything that you can do, but at least your child is ill, you have a G6Pd deficient child, the child is febrile, quickly take to the hospital. And then let's be on top before the child starts hemolyzing. Okay, and then the food too. Avoid your fever beans or your broad beans or any other trigger that you have noticed. And let the teachers know about it. So maybe your child is going to boarding school. Let them know that your child is G6Pd deficient. Because maybe the housemaster or housemistress would have put camphor in the dormitories because of, I don't know, bed bugs or insects. So they know that because of G6Pd, they should not do that. Right. So it's important that parents, we do some of these things. The diet is always important. I mentioned that the G6Pd enzyme helps keep this antioxidant in good amounts, the glutathione. And glutathione is not the only antioxidant in the human body. There are so many other antioxidants. So you have vitamin C is an antioxidant. You have vitamin E, even vitamin D, zinc. Vitamin E, zinc, iron, they all keep the integrity of the red blood cell. So I always say that if you are G6Pd deficient, it's like having maybe 10 soldiers, 2 of them died. So you now have 8 soldiers doing the work of 10. So just give them ammunition to do the work of 10.
Just enough ammunition.
Exactly. So you flood the child's system with enough antioxidants so that when there is a stressor, the other antioxidants will take over the job and the likelihood of your red blood cells breaking down will go down. So feed your child well. Right. So the leafy greens, the colored vegetables, because the different colors have different plant nutrients, different phytonutrients, and they impact the body with different antioxidants. You understand? Colors of the rainbow. So feed your child well. And then try and avoid ultra-processed meals, because those processed foods do increase free radical damage. So reduce your your processed food, increase your antioxidants.
Give us examples
of the processed foods.
Some people want to hear from you.
So let's say these drinks. I don't want to mention any drink, but there are some drinks. Mothers, we should really read the labels, because sometimes maybe you go and buy a drink, you see a grape on it, so you think it's grape juice. But when you read the ingredients, there is no grape. It's sugar, flavor, water, color, preservatives, and all those ingredients, sometimes about 20 or 15 on one bottle. All these are chemicals. They are not nutrients. They will enter your child's bloodstream after being absorbed through the tummy and go and cause the stress on the red blood cells. Your child can hemolyze. So you want to flood the body with antioxidants and reduce free radicals. So if we can make our own homemade juices, let's try. It may not be feasible every time, but let's try so that our children can actually get real nutrients. And then we should learn to read our labels. And the processed food, the children too, processed food is quite addictive. And now they are making foods in their lab that target the center in the brain for addiction. So you go and taste that food, every day you're addicted. So you make banku and oko, the child said, I will not eat. I want to go and eat. So you're in our run.
You don't want to mention
go and buy KFC for your child. When you're all eating banku and oko, every day KFC, every day KFC, your child will not be healthy. Maybe once in a while. Maybe once in a while. So it's important that we avoid the ultra-processed food, because they increase free radical damage. And they increase your antioxidants. Drink lots of water.
In a bid to get an easy life, please consider the health of your kids.
Exactly.
So you are still watching the Two Words Moms show, and we are talking about G6Pd. We are almost rounded up. Doc, I want to ask you, well, can they have normal lives?
Oh yes.
They can have normal
Oh
lives.
yes.
So
In fact,
the
it's
parents
not a
shouldn't
big deal.
be
They
scared.
shouldn't worry. They shouldn't cry. It's not a big deal at all.
Yeah, as I'm just finding out.
It's not a big deal. You can actually live your whole lifespan up to 100 years, and you would not even hemolyze.
Yeah.
I have a good friend. She's a doctor. She always said she was G6Pd full defect. And then I actually observed she had
I
an
am
infection.
Full defect.
You are full defect.
Yeah.
Okay. So she had an infection. And then she was urinating like frank blood. Usually they urinate like Coca-Cola, but this one was like frank blood. She almost went into kidney failure. We were preparing for dialysis, but thank God for good treatment, she recovered. So she hemolyzed once. Now she's almost 40 years. She's fine,
her
she's
whole
healthy.
life.
So once, I don't think she'll even hemolyze again. So it's not really such a big deal. It's not something that you should be worried about at all. There are so many ways you can protect your child.
Yeah.
Okay, so just try and do that for your child and they can have a normal life. And then anytime you see that your child is hemolyzing, go straight to the hospital because the child will need to.
Shouldn't self-medicate.
You should not, because the time the child is having the dark-colored urine, that Coca-Cola-like urine, what you are seeing is hemoglobin. And hemoglobin can damage the kidneys, so the child can go into kidney failure. Okay, so example, a child has malaria. Okay, malaria is not, malaria, well, a child under 5 years, they can have severe malaria. But malaria, we have been living with malaria. I mean, it's not something that should kill your child.
Yes.
But because your child is G6Pd deficient, the child will suffer more or hemolyze more from the malaria because of the G6Pd deficiency. Okay, and that dark-colored urine can now send the child into kidney failure, requiring dialysis if the child is not seen promptly. So the moment you see the dark-colored urine, quickly send the child to the hospital. We'll give IV fluids, we'll do some tests, if it is antimalarials, antibiotics, whatever we need to stop the infection if there is an infection. And then to hydrate the kidneys so that the child can be free.
Doc, I was going to let that go, but you see, talking about the urine, most kids are in diapers. Will it be that dark for you to see in the diaper?
Yes, you can. You see it. If it's dark enough, you see it in the diaper.
Wow.
It is so visible.
Wow.
If you are not sure, you can just bring your diaper to the hospital and say, I think then might have a G6Pd, maybe baby, and this is the color there. I'm not comfortable.
Okay.
But with mothers, after some time, you will know the color of your child's urine. Usually it's clear or straw colored, but if it's concentrated or dark, you may want to bring the child to the hospital.
So I'll ask you this final one, then you add your final word, because all too soon we have to come to an end of the interview. Is it more dangerous in boys or more dangerous in girls, or it doesn't have to do with the sexes?
It is commoner in the boys because it's an X-linked.
Okay.
So if you have a boy who is, let's say, G6Pd partial defect, and you have a girl who is G6Pd full defect, so that means that the girl's enzyme levels are down. So it depends on the level of deficiency of the enzyme. Okay. So it doesn't matter the gender. Okay. So if you're a boy and it's partial defect, it's better than a girl who is full defect. Okay.
Final word to G6Pd parents.
I think that for the parents who do not know the G6Pd status of their children, they should quickly go and check. You can walk into any lab and say, I want to know my children's G6Pd status. And as I mentioned earlier, if the child is hemolyzing, at that time, it may give us a false negative report. So once the child is happy play, you don't know your child's G6Pd states. Please go to the lab or go to the hospital and then request for labs to do your G6Pd so that you can be advised. You'll be given a list of things to avoid if your child is G6Pd deficient. And it's not something to lose sleep over at all. As I said, I have a G6Pd full defect son. He's never hemolyzed. He's doing well by the grace of God. So it's something that we mothers and fathers, we can handle. So don't worry. But if you have any questions too, you can also talk to your pediatrician. You can talk to your doctor. You can talk to your healthcare person. You're a pregnant woman, don't put camphor in your baby's clothes or your clothes at all. You are going to deliver. You know you are not G6Pd deficient. Don't put camphor in your clothes because your neighbor at the ward may have a G6Pd deficient baby and now come and inhale the camphor in your clothes and hemolyze. So let's be each other's
keeper. You can call Dr. Nkansah. I'm giving you a number for free. Call help 020-816-1123 for all your questions, okay, related to the kids, because she is a pediatrician. All too soon, we have come to the end of the interview. We will be right back.
This program is proudly brought to you by Appiah's Trendy Wardrobe and Kitchen, Kokado's Healthy Cuisine, and Vista Pediatrics.
Welcome back. You're still watching the Two Words Moms show, your favorite parenting show. Once you see me smiling like this, it means you are at the playground. I love putting my guests on spot. And today, we are coming to play something we call sit and act. It's more of a charade. So I have some, I don't know what they are, but yeah, they are here, written pieces of information in this bowl. But Nkansah is going to act them out. And then I will say what it is she is trying to tell me through the act. Doc, are you ready?
Very ready.
You know, if I win, I'll take money.
No problem.
Okay, I like the vim. Doc, you just have to, I don't have to see what it is. You just have to act it out, and then I'll guess what you're trying to say. Okay. Okay. Playing, dancing, singing, you're being joyful. Let's try again. A child is happy.
Hey, as for this.
A child is happy. I still have more time. Please keep going. Keep going.
Okay.
Birthday.
Celebrating birthday.
Oh, but at least I had a part of it.
I think it's because, celebrating birthday.
Birthday.
Yeah.
Yeah. I mean, you did that, and I knew it was a cake cutting.
Yeah. Done well. Hey, because I actually.
Okay. So.
All right. I must pick another one.
No, please hold on to that so that it doesn't mix up. So you give me that.
Right. Hey, I'm going to do all this acting.
Okay.
Hey.
You are in love? I'm in love. I miss someone. I want to hug someone.
Yes. It says that. I think we should give it to her. Showing love and affection.
I think I should get.
I think she should get it.
Yay! 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 I got it.
Well done.
Okay, dog. That's 200 cities already. I'm rich. By the time I get out of here, I will buy a house.
Okay.
Teaching your children the word of God. Helping your children with homework.
Helping with homework.
Helping with homework.
Yeah. Well done.
See, I'm a genius. Woo! Doc, missing them if you have.
That means that I'm a very good actress.
You are actually.
Hey.
You're feeding a baby. Are you feeding a baby?
You are feeding a baby.
Oh, do it again. Do it again. You're feeding a baby using a feeding bottle.
Yes.
Hey, I'm such a genius.
Good actress.
And doctor, such a good actress. Can we still go on, or is our time up? Okay, we can go on.
Here.
Singing a lullaby, cuddle a baby. Please, I won't do again. I won't do again. Okay, Doc, let's do the last one. Doc, you owe me like 1,000 CDs already. Oh.
No, you owe me.
Ah. I know this one.
Say it.
Play Peekaboo. And that brings us to the end of the playground segment. We will be right back.
This program is proudly brought to you by Appiah's Trendy Wardrobe and Kitchen, Kokado's Healthy Cuisine, and Vista Pediatrics.
Now, welcome back from that short commercial break. You're still watching the Two Worst Moms Show, your favorite parenting show. As you can see here, all the guests who come on this show, we don't just let them go like that. We have one of our sponsors giving us this wonderful package, your favorite healthy cuisine here in Takoradi. Doc, I know your favorite, like all of these things. I know your favorite. Should I point?
Yes, do.
This.
You're right.
Anything beetroot is for Dr. Nkansah. So we have here Body Bliss that has mango, cucumber, apple mint, and ginger. I mean, per your preference. Kokado's has everything. We have Burst the Beet. I love this name. Orange, beetroot, apple, and ginger. We have some sandwiches here, and then we have parfait. Thank you to Kokado's for sponsoring this segment. You can get these and more from Kokado's. Thank you also to Appiah's Trendy Wardrobe for sponsoring our show. Doc, so there you go.
Oh,
before I take everything to my house.
Thank you, Kokado's.
Thank you all for watching. We are on your YouTube and your Facebook every Thursday. And since we are no longer bringing the live sessions, just feel free to just be going up and down our channel every Thursday. Next week, we bring you yet another intriguing and educative topic. Thank you to our guest, Dr. Nkansah. Thank you to our sponsors. And thank you for making time to watch. See you next week. It's bye-bye. Mwah.
This program is proudly brought to you by Appiah's Trendy Wardrobe and Kitchen, Kokado's Healthy Cuisine, and Vista Pediatrics.